Hey guys, how you doing? Mike Galbraith here, along with my partner in crime,
Brian Boehme, physiotherapist here at Leeds Sports Medicine.
Yes, I'm a family and sports medicine physician. We're going to cure your body today. Today is Ask the Doctor section from our fictitious questions on our index card. And so these are questions we get all the time from patients that we want to be able to ask, and in the future feel free to send some our way. Brian prefers if you text them directly. But we have these weapons.
Yeah,
so
please, yes.
I will refrain myself from beating you today.
I appreciate that.
Yes, we're going to take it easy on Brian. He's had a little hamstring issues, so...
I appreciate if you wouldn't talk about that.
Okay, patient confidentiality.
Thank you.
Revealed.
All right.
So, let's say, in theory, I actually have a lot of upper back muscle tension. That's right, I gotta work on my posture again, in case my wife sees this video. There we go. So upper back, a little sore, muscle spasm. I know this is something that you use regularly for patients.
Yep.
Teach me, what in the world is this and how can we use it?
Known as a couple different names, Theracane in maybe the physio world, but shepherd's hook as well, a couple different names. Those are the two most common names that I've heard.
Mm-hmm.
But with the big hook, it's wonderful for a number of different things.
Mm-hmm.
In particular, as we already talked about, just tight, and it's a classic area that is tight for lots and lots of patients, where whether it's a posture thing, whether it's a stress thing, whether it's a work thing, whether it's an injury thing, maybe any of those combined together. Lots of different patients that have tension up there and are constantly looking for ways for their husband or wife or significant other or whoever to just rub, and it just never seems to be enough, or they can't get their significant other to actually do that. So
that never happens.
I would never imagine that would happen in anybody else's home. But this is this simple solution. So I would take something like this, and you could basically put this right over your shoulder.
Okay.
And I'll just kind of walk you through it. So
Am I
once
blocking
again,
your vision?
No, I'm
Do
great.
you prefer this side?
That's okay either way.
Okay.
I just more am concerned about our wonderful videographer, if that's even a word.
Oh.
And he could maybe stand up and just kind of get a different angle. So maybe it'd be better if you came on this side.
What if I come over?
That's okay. So that's perfect. So right in here, in this case,
Between my broad shoulders.
there you go. I was going to say that, but you already did. On this one here, another classic area that's tight with lots and lots of patients, as I said already, for different reasons. In this case right here, this is a good place to start. If you wanted to get a patient that had tension in all these different areas, you could start lower or start higher. It doesn't matter. The nice thing about the cane is it reaches all these different areas. In this case right here, so if he finds a good spot, all I would have a patient do then is make sure when they find a spot, and we've mentioned it in other videos, that they make sure that it's tolerable.
Okay.
Because I've had patients time and again come back and talk to me and say, Brian, I'm really sore in that spot now. And I'll tell them, well,
Can I still hold it?
key things to remember. One, make sure it's tolerable. I've mentioned this in other videos. Two, it's not how hard you press that makes the difference. It's how specific you are when you press. So I'll give you an example.
Okay.
So if I help guide you right here, you said you got a spot right there.
Yeah.
Tight. If I change the angle and bring it up like this, is that worse? Or is it worse here? I mean, you can do lots of different things, but that's the idea.
That's good.
Find and localize the spot where it's the most symptomatic, maybe I'll put it that way, which usually means the most tight
It hurts.
and correlates with the most tension
Okay.
generally.
Uh-huh.
So once you have the spot, I'll just say leave it there, and then you could do one of two things. You could do something as simple as turn your head,
Okay.
and that could make a difference, because technically when you turn your head, the movement in that area should efficiently go right down the spine. Now because you have a spot right there that doesn't move very well, you'll localize that movement.
So I find like if I rotate this way,
There you go.
it's a little more tight.
Then that's what you would do, is you'd focus that way. You could go to the right and then flex or
Okay.
extend. It just kind of depends on what you feel gets it just a little bit more specifically. I've had patients though that maybe have some troubles with their neck. So to use their neck is not the best idea for them.
Okay.
So you could do something, as I call it, a chicken wing. You could do a little chicken wing.
With my left? Or
Yep, with that arm, yes.
Okay.
Just like that. And that for some patients, like, ooh, that really gets it there too.
It's pretty good.
So it just depends. You could use a combination of that. Really, in the end, I don't
Can
mind necessarily what you do, movement-wise, as long as you feel like it localizes it really well and it's effective for you.
Sounds good.
So to remember, make sure it's tolerable.
Yep.
Two, because this is aggressive, and I've had patients struggle with this, as I mentioned before, if you do it too often, you're asking for a bruised area. I don't want it bruised, I just want it moving better.
I don't want it bruised either.
That's my point. So you do one spot, then you move on. do the next spot, move on, do the next spot. So you're not randomly all over the place. So if you're going to start low, gradually go high. If you're going to start high, gradually go back down lower.
So how many times a day would I do this?
You're not doing it every day, that's my point.
Oh, okay.
Because it's aggressive. If
Okay.
you did it every day, you would be bruised and sore. So you're looking at maybe a couple times a week.
Okay.
Maybe 3 at the most. That way you always give it a day to let it recover.
Yeah.
And then you could try it again.
Perfect.
So as long as you follow those general guidelines, you should not overdo it. But I mentioned before in the other videos as well, you might turn your head 5 to 10 times and then you move it. Or you do a little chicken wing 5 to 10 times, then you move it. Because then your chances of actually irritating it more so than what it's rated for is less and less.
You know, I've seen some of these Theracanes, even some people have handles they can hold on to here.
Yep.
The one we have at Elite Sports Medicine is just a simple candy cane, basically.
I have found honestly that those are just as effective, just because most people use the main hook.
Yeah.
You can grab onto this. The other little knobby ends are oftentimes for grip, or you can use them for other things. It can be a little bit more complicated. I just find this is the easiest use for it.
Generally speaking, I know we have these at Elite Sports Medicine. You can buy them here. Any other places in town, or where else can a patient get them?
You can. I've heard them at some stores in town. You're looking at about $40.
Like some of the pharmacies, or?
Pharmacies, I know I've had them. Shoppers Home Health, and it's funny place. I think Bed Bath & Beyond has carried them as well.
Nice.
So home care,
Interesting.
decor, and
How handy is
triple
that?
threat guy.
But I know we found, like, consistently we couldn't find them at those places.
Yes.
That's why we decided just to start carrying them here too. But
Yeah.
there's options, yeah.
There's definitely options.
Well, I like that. Yeah, this is something you can do at home, and it's again, it's another self-driven treatment that hopefully can motivate and
It's
empower
quick,
people.
it's easy, and like I said, if you can do that at home, you can really do a good job to
Nice.
maintain staying on top of that tension that is so
Perfect.
common.
Well, that was awesome. Here is the Theracane exercise, which it's often used for the back. I know it's used for other areas. We can go over that sometime too. So hope you guys have a great day and stay healthy.